Join us for the next few moments as we sally forth into a world where Obamacare has driven all prices for health care right into the ground, where there are no price increases for anyone. Insurance companies are happy to lower their rates, and Obamacare critics see the error of their ways. This is called Fantasyland, and those still gleefully buying tickets to this magical place are also those who believe in candy-covered hilltops, Pauly Shore being the greatest American comic that ever lived, and George Lucas not screwing up Star Wars with the introduction of Jar Jar Binks. Come back to reality land with the Newsmax deputy health editor, Nick Tate, who joins us here in studio. I had to get through all that because what's going on with Obamacare right now is all fantasy. Now we have the administration going to the state saying, oh, wait a minute, you got to cut back those rate increases right now because they're really not good for the consumer. This is what they should have known from the first moment that they brought Obamacare to the floor.
You know, there have been a lot of debates on what Obamacare would bring. There's been virtually no debate that the fact that Obamacare, the Affordable Care Act, would lead to a rise in healthcare costs. And now that's really coming home to roost. In the early days of Obamacare, healthcare insurance rates were rising just a little bit, 3.5%, 4.5%, which was still higher than wage growth, but not that great. But now we're seeing this year rates are going up 7.5% on average through those Obamacare exchanges. And next year, insurers are talking about increases of 10 to 40% and as high as 52% in some states. The irony, and it is irony, is that the White House is now suggesting that the insurers are wrong for doing all these things that this law has required them to do, meeting these higher costs, covering all patients regardless of their ability to pay, and more sick or older people are signing up than younger, healthier people, and suggesting somehow that the states now that they've taken the power away from should step in and regulate those rates.
Let me get in there when you talked about the ages here, because how could the Obama administration or anybody with a brain in their head logically have stated flat out, oh, don't worry, everybody's going to get healthier as we go along. Right. We've got states here right now that are showing the drugs that people usually take when they're in their 60s, 70s, and 80s, they're going through them like water at this point. Right. They are not getting healthier. They are sicker than they were, right? That's where this is all coming from.
Well, two things to know. To balance the books on Obamacare, more younger, healthier people between the ages of, in their 20s and 30s needed to sign up. About 40% of the people who were going to sign up for these new Obamacare exchanges needed to be in that age
Which was the assumption the Obama administration made from the start.
The health care would be so good, it would be so affordable that, of course, young people would want to sign up. But that's not happened. Only about 1 in 4 of the people who've newly enrolled are in that age group. And the vast majority are older individuals and sicker individuals. So they cost more to care for. They use more health insurance services. They use more services. They take more drugs. And as a result, to balance those books, now the insurers are saying we have to balance those costs. Now, the hope is that recognizing the new financial reality, someone, hopefully in Congress, maybe running for president, will step up and say, we got to do something about this. And I think that it's time for consumers to really get angry.
Here's the other side of this, too. The Department of Health and Human Services, they talked about low premiums, about $100 a month. But, and I seem to remember that you and I might have talked about this umpteen times. They didn't talk about co-pays, deductibles, provider costs that are really all out of reach. So they took one set of numbers and didn't bother to include everything. There's another trap.
It's an incomplete picture. And in fact, that $100 a month number is disputable, too. You could argue that that hasn't been the case for the average American who's bought these insurance policies. But we know deductibles are going up. The vast majority of Americans that have now company-provided plans are paying deductibles of $2,000, $2,500. Drug costs are through the roof because prescription drug costs are rising, and a big part of the share of what insurers are paying. So to talk only about premiums is really only missing a part, is really only talking about a very small part of this. I've been talking to doctors the last couple of weeks for a piece that I'm working on who said that what they've seen is a growth in the number of Medicaid patients who have all their insurance paid for under Obamacare come into their offices for treatment. But privately insured patients are either skipping their doctor appointments or skimping on recommended care. And the longer you skip on recommended treatments and checks for things like diabetes and heart disease and cancer, the greater the costs are going to be, not only for that patient in terms of personal and financial costs, but for all of us as a country down the road. So we're pushing away from prevention, routine treatments, and again, rising those costs.
Less than 60 seconds. Here's another part of this. The cost of generic medications is rising substantially here. Now you've got a backlash over that. You've got some people who can't afford their drugs already. They're sometimes 5 times what they should have cost. Look, if you want to go after somebody and make healthcare more affordable, why don't you go after the drug companies who are literally sticking it to the consumer every chance they get?
Now, we're not going to can argue that drug companies shouldn't make a profit. That's fair in this country, but the profits are just obscene in some cases. When it costs you $80,000 to $100,000 to treat a case of hepatitis in this country, and you're paying much of that cost out of pocket, who can afford that? It's gotten so bad that oncologists and cancer doctors have actually called for a variety of options that will lower those costs, including making drug companies provide details on why their costs are so high and how much their research and development costs are, and allowing people to buy from Canada. So that's where we are. We need change, and as always, the pocketbook is really going to drive it.
I just want to hear the supporters continue to try and take all these facts and all these stats and say that they're all bogus, which we know they can't do.
But you know they're going to.
Well, of course. That's what makes it a talk. And there you go. That's why we're here, to go ahead and set it straight. Don't forget, the Obamacare Survival Guide. Get it now. Obamacare411.com. Nick Tate, thanks a lot. Stay with us. The Hardline continues.